Welcome to the Talking HealthTech podcast. My name is Peter Birch. Today on the show, we're continuing our mini-series focusing on innovation in New Zealand in collaboration with NZTE. And for that, I'm very lucky to be joined again by Rob Milsom. G'day, Rob. How are you going?
I'm doing fantastic, Pete. How are you, mate?
I'm really good, really excited to jump into episode 2 of 3 of showcasing some of the great innovations coming out in New Zealand, thanks to NZTE helping make these bumper episodes possible, because there's some great stories around innovations where we do some deep dives with, in particular, with individual organizations sometimes on the show. But really, we're bringing 4 organizations in this episode. And also there's a previous episode in the feed you can check out and one coming up later on. But today we're really focusing on people. So the clinicians, the patients, and the technology that connects them all. Can you introduce to me, Rob, who we've got on the show today and a bit about what they do?
Absolutely, Pete. Thank you very much. Yeah, I'm really excited about this one. You know, health, the crux of health is all about people helping people, and that's what these companies are going to showcase here. So New Zealand companies reimagining clinical workflows and patient engagement. So first up, we've got Dr Kieran Holland from Streamliners. He's going to be talking about their health pathways product and how it bridges policy and practice at a local level. Following Dr Kieran, we've got Ron Tenenbaum from the Clinician, and Ron's going to talk about how PROMs and PREMs are working together and how patient-reported outcomes are reshaping care across the country. Following Ron, we've got Dr. Stephen Poole from Core Schedule. Stephen's going to share his journey as an ED doctor turned tech founder, building a rostering platform clinicians actually want to use. So that's going to be very interesting. Following on from Stephen, we've got Niru Rajakumar from McCrae Tech, and Niru is going to give us a real-world view of hospital modernization and the importance of listening first when building tech for people.
Super important, and all of those I could have spent an hour discussing with each, and they're all passionate individuals. So looking forward to bringing you this episode today, and I'm hoping that it kind of showcases that innovation isn't just about the code or the technology. It's about listening. It's about designing for people and building that trust. So let's get stuck into it, Rob.
Sounds good, mate.
Thanks, Peter, for having me. I'm a long-time listener. So I'm the Clinical Director of Research at Streamliners, and we support Health Pathways and the Health Pathways Network. If you're a clinician, Health Pathways, it's a website that blends evidence-based clinical guidance with information about how to navigate the local health system. So it's not just the latest information about how to assess and treat people, but it's also about how you get advice from specialists and how you access community and hospital referred services when you need them. It's designed for use in the consultation room, so you're looking it up with the patient in front of you. And it saves you time guessing and hunting around for information. So it gives you confidence that you're doing the right thing. If you're the patient, it means that your clinician has all the options in front of them. So you can have an informed discussion about what's best for you. And it reduces the chance that you're getting bounced around the system. If you are lucky enough to be running the health system, then it helps you get evidence and policy into practice. And this process can take years if you don't have pathways.
No, look, and I hear that problem, and it's one that no doubt is consistent across New Zealand, but in other parts too. And in Australia, we, feel that need for those pathways to exist as well. So from your perspective, what can Australians learn from, or the Australian healthcare system learn from other countries' approach to health pathways?
Yeah, so Health Pathways started in Canterbury in New Zealand, but over the last 15 years, it's been implemented across New Zealand, Australia, some of the UK and Canada. So there's about 54 implementations now around the world. And the organisation I work for, Streamliners, supports that network and it operates a bit like a social enterprise. So it's 20% owned by the New Zealand health system and 80% by a charitable trust that supports integrated care. And the benefit of that network is that we can and we do all learn from each other. And so perhaps the best example of that was during the COVID response. evidence and policy was changing so rapidly that clinicians really couldn't be expected to keep up with the front line. So what we did was formed an international team that collaborated with experts to translate the key messages into pathways and get community-based models of care into practice. And I think perhaps for Australia, the opportunity might be around more national collaboration. So in New Zealand, in Wales, there's now a national program. So all of the local implementations work together to reduce the duplication of effort in developing the pathways, to reduce the unwarranted variation in care across the country, or the so-called postcode lottery. And I think in Australia, there are opportunities for more national collaboration. Having said that, some of your listeners will know that there was recently a lung cancer screening program launched in Australia, and despite not having that national program, the local teams have all worked really well together to develop national pathways so that GPs know what to do, know who to refer into the program and what to do with the results.
Yeah, there's a variety of applications of that across the system. I can see that. I guess as we all kind of see within healthcare too, it's one thing for us to have the need to deliver services, but we're always looking to do more with less as well. And there's always pressure on health budgets. What's in your eyes the impact on health pathways of having, say, constrained budgets, but this continued need that you talk about of needing to do more with less?
Yeah, every health system we're working with is under huge financial pressure. And I think the irony is kind of that's when you most need to work on efficiency and quality of care and invest in system enablers like pathways, but it's often also when it's most difficult to do that because you're trading it off against frontline services. But what pathways can do to help is really provide clarity about what the public system can and can't do. I think we all know, but we're not necessarily all comfortable with talking about the fact that it can't necessarily meet everyone's needs in full. But when you've got pathways, you can at least decide equitably how to prioritize that care to the people that need it most and who have the most potential to benefit from it.
Lastly, Kieran, you've given us a bit of a picture into, where we're heading now and a little bit of a glimpse into looking ahead. But what's your vision for the future of health pathways?
Look, I'm really excited about the future. I think particularly with the advent of recent advances in AI, there's a lot of opportunity to improve the user experience of pathways for clinicians to get from the question to the answer more quickly, and potentially even to work towards having more personalised pathways that are tailored to individual patients. I'm also excited about the opportunities that I still think are ahead for the Global Health Pathways Network. So often a lot of innovation happens at a local level, but it's not often shared globally. So I think we can help propagate the really good ideas across the network and get more collaboration happening between local systems across the world.
Ron Tenenbaum. I'm the founder and the CEO of the Clinician. I'm a former clinician surgeon myself. The Clinician is a company that focuses on helping health organizations shifting to value-based healthcare models. We provide both consultancy, but mainly provide our digital platform as means of implementation. Key focus is on bringing the patient perspectives, the patient voice, and integrating it into the clinical routine care.
Got it. And I know your world revolves around those 4-letter acronyms we know and love that start with P in healthcare, the PROMs and PREMs. Those unfamiliar with it or perhaps heard the terms being thrown around, sometimes we can use them more loosely than others. I'd love to get your take on the role of PROMs and PREMs, what they are, and why they're such a critical tool in patient care these days.
Sure. I can talk about it for 5, 10, or 2 hours. I'll try to keep it.
We've got 2 minutes. No.
Okay, 2 minutes. PROMs and PREMs are essentially they're the patient voice, but captured in a structured way. Now, PROMs are quite different to PREMs. I'll start with them. They're the actual outcomes, how patient feels, their functional status, how they're going about with their quality of life. So we're measuring the perspective of the patients about their health status. PREMs are the experience of care perceived by the patient. The care team communication, the empathy, and overall the service, how it was delivered. Now, combined, both of them, they're underpinning now the what is called the value-based care delivery. And we usually look at them, and this is where I'll try to keep it concise, but we're looking at them at the micro, meso, and macro level. So at the micro level, they're helping at the cold phase clinical encounter to guide the actual treatment, the care service. Meso, they're using a lot for quality measures, for benchmarking. At the macro, very interestingly, they have an economical use. So if you're looking at your generic PROM, they, depending on which instrument you use, they could also compute what is called QALY, the quality adjusted life years. Very quickly, if I'm measuring a patient undergoing, for example, hip replacement, and that patient scores between 0 to 1, where 1 is full health status, let's say that they're scoring around the 0.6. And I'm looking at using an intervention that costs the taxpayers around 20K. What is the health gain that I'm projecting for that type of treatment for that specific patient? So is it a 0.3, for example, to take them from the 0.6 to 0.9 quality of life adjusted years, and what is it costing? So take that for the specific patient or for the patient cohort. This is where it is used on a macro level for budgetary planning. So as you can see, they have a lot of different value proposition depending on the layer of the healthcare that they're being used at.
Yeah, I can see that, and definitely at the top end, at the macro level, I could see applying it to decision making and aggregating information up, and that all makes sense. I guess and I can see the value further down too. That's great when we've got the information, but in order to get the information, there's a lot of that's the trickier part, I guess, in terms of we've always done healthcare in a certain way, and it often heavily relies on clinicians in participating in such programs, that capturing the right information in the right systems, and the whole system itself. For a health system, there might be challenges in implementing the capture of, say, proms in the day to day. So what do you see are the biggest hurdles and the ways to overcome the challenges in implementing the measurement of proms and but both for the system level, but also getting those clinicians engaged in the process too?
I think the latter part of what you just said is actually the biggest thing. So it is, the challenge is not technology. Yes, technology obviously needs to be standardized, needs to be interoperable, scalable, and secure. The real challenge is culture. It is culture. And you're talking about shifting the mindset to a partnership model with patients. This is first. Overcoming a bit of inertia that we're seeing at the moment and integrating the prompts into the workflows in a seamless way, in a way that is easy for clinicians to use it. Building trust with clinicians. I was talking about before in the meso level, you have the benchmarking between clinicians. So you need to show this is not to try and gauge how you work, and not to judge you. This is more of empowering you with data to make better decisions. So our role in all of this challenge is to try and provide both the platform, but also the crucial change management support to make the proms and prems implementation stick.
Look, this is where we could extrapolate this into a full-length episode in itself, because as soon as someone's got a scorecard in inverted commas or a measure to look at and a before and after, and if you're an individual as a clinician, the amount of cultural weight, I'm going to say, that comes along with, well, hey, I'm in this particular region, I'm dealing with these particular patients, and why would you compare me to these? Yeah, anyway, that's a whole other conversation that I know is much more your world as well. But I guess given that's the world you're operating in, I can see the complexity, but also the solutions that exist there. Given all of that and the work the clinician's been doing, what's your kind of vision for the future then? What's the vibe? How are you feeling about all of this? So like, as we move towards more, say, virtual and home-based care, and we're tying in all these issues around policy and funding decisions, how do you see the vision around proms shaping how we do healthcare in the future?
So first of all, I'm feeling very strong about it, and I think from where the vision started to measure, we're now actually looking at how do we help improve outcomes. You're talking about virtual care. You could actually position PROMs as the vital signs for virtual care. I know there's a lot of hype around the objective measures of wearable. Being able to monitor patients from home, but how do you actually measure patients' feeling, patient progress, ongoing? This is where PROMs comes, and consider the fact that PROMs have been implemented now for 3 decades, but mainly in the research realm, and so they've been formed to be, I would say, even overqualified for what we're using them in clinical routine care. They're standardized, they're validated. There's a way to look at them, what they collect in a subjective measure, transforming it to objective measure. So being able to get that objective measure in remote is super important, and I do see a very strong future for them. I actually see them as a pillar.
Hey Pete, glad to be here. Niru Rajakumar, CEO of Hospitals at McCrae Tech.
Excellent. Tell me a little bit more about Hospitals by McCrae Tech.
Yeah, sure. We're a newly formed company, 4 months into the launch of the company. And for those who don't know, we're a spin-off company from Orion Health on the back of their sale earlier this year. And so Ian McCrae, the founder of Orion Health, also founded McCrae Tech and wanted to continue his legacy of modernizing healthcare. And so here we are.
Amazing. For those that want the deep dive, they can go back into the feed. There's a recent episode of Niru and I having a chat during Digital Health Festival on the NZTE booth, no doubt. So as part of this broader conversation in this mini-series with NZTE, I'd love to get your take, I guess, today on the real challenges that McCrae Tech are addressing in the healthcare space, particularly for hospitals.
Yeah, sure. Look, I think we can all agree that we're at a really interesting juncture in healthcare at the moment, being that there are very common challenges around the world, not just in Australia and New Zealand, but everywhere that we can see, especially from a shortage of workforce. You got the World Health Organization predicting about 10 million shortage of healthcare workers by 2030. I think the healthcare system, you can say that it's getting naturally more and more complex to navigate as a consumer, as a patient. And then when you overlay that with this sort of the burnout problem that I guess the workforce is having, we're at a perfect storm. And so us as a newly spin-off company, we want to really harness a few things. And from a hospital's perspective, it is about creating that next generation of the hospital information system experience. And we're doing that in a few ways, and I can get into that. But I guess it's really to build on the base we've created over the last 30 years, even at Orion Health.
Yeah, there's something in that, hospitals, healthcare systems, and all the legacy that comes along with the new spin-out company of McCrae Tech. It's one thing for us to say, well, let's do things differently, but at the same time, there's not a great deal of appetite and, frankly, resources to, I guess, reinvent the wheel, so to speak. So I'd love to get your take on how do we leverage some of these existing resources and capability while still doing something different and new? Because if we keep doing the same thing, we're going to get the same result, right?
Yeah, absolutely. And unfortunately, history does sometimes repeat itself, and we don't want it to all the time. And so I think it's really about two parts of it. There's the human side, which is how do we make sure we collaborate as humans and actually have engagement so that we understand what's happening on the front line so that clinicians can look after the patients the most optimal way. But then what we do on the technology side, which is the enablement side that we would like to call it, which is giving those people the right technology and educating them and training them in the right way so that they can provide that best care. But ultimately, we want them to use our technology as least as possible so that you actually get better time with the patient and or the consumer, whoever they're talking to in the front line. So from a hospital's perspective, it's really, for us, it's simple. The vision is to be able to streamline that end-to-end patient journey the moment they walk into the hospital door, right to the moment that they walk out. So we're on that journey at the moment on a few different things that we're focusing on, including leveraging AI technology.
Got it. I guess the application or the use case of these kinds of technologies in those healthcare settings is certainly applicable in New Zealand, but I know you've got a good amount of experience and exposure in the broader APAC region as well. What are you finding are some of the consistent themes or applicable lessons that one region could take from another? Because everyone's at different stages, and sometimes that means it doesn't necessarily mean one's ahead of the other. It just means that some have perhaps leapfrogged eras and have got the flexibility to try new things, different populations, all those things. You would see that on a day to day. Tell me about your thinking in what different countries in the region could learn from each other.
Yeah, sure. I think the key there is the sort of digital transformation, if you like, if you want to call it that, in the context of enabling tech in hospitals, at least from my perspective. It has evolved quite a bit, because historically what we've seen is that usually you go through a procurement cycle and you put in a big hospital platform or a system, and then you kind of go, how does it improve the workflow, or how does it give ROI for the hospital? What I'm seeing now more and more is that the appetites change because the risk level is arguably higher and stakes are higher. And there's kind of the macroeconomic issue of, can we invest and have the ongoing investment into technology without having a clear line of sight for ROI? And so what organizations are doing, not just at a business case level, is how do we start small and then scale over a period of time, but scale smartly? And I think that's one of our differentiators, is that we do offer that. It's not let's just plug in a system and then off you go, but it's actually having a real modular and flexible approach to it, both at a technical level, but also at a commercial level to offer that.
Yeah, we're not really. There's not too many systems that can rip and replace or can totally transform overnight how they do one to another. That obviously makes no sense. So having that ethos of and being okay as a partner like McCrae Tech to go in that modular approach or piece by piece and go on that journey with the health system, I think is going to be really important. It kind of alludes to my last kind of question or thought from you. I'd love to hear from, I guess, how you see the future, because I'm going to hazard a guess that there's going to be some AI involved in the future of healthcare everywhere, but it's also not as simple as just waving AI at things and then it magically fixes itself. So how do you see the vision of the future of healthcare and the role that some of these technologies play?
Yeah, I think it has to start with the consumer first and foremost. That makes sense to me. And as a consumer myself, I would like to think about back to shifting left in terms of the experience of the healthcare for the consumer. And when you put that into context, at the moment, for the most part, it's still reactive. You get sick, you go up and see a doctor, and then they prescribe you. You get treated for a bit, but it is pretty much a Band-Aid. And so start thinking about the wellness picture much more holistically. And that means that you need to actually have connected systems to achieve that, right from my watch going off to actually telling me, these are your 3 things that you should be focusing on today, around diet, sleep, nutrition, to right till the point where if I do need to have a consultation with one of my GPs or a practitioner, I should be able to do that, at the comfort of my own time and home at the right place. And I think all of that is an important part of what I see the future of healthcare. But I think that actually thing is just the foundation of it. That's table stakes. So we need to do that right before we start thinking about how AI can come and revolutionize healthcare. Because, as we know, it's a bit of a it's real, but it's a bit of a combination of a hype and buzzword in some cases. And so it's about really picking out what's working, proving it, and you got to do that at a use case by use case at a time.
So I'm Stephen Poole. I'm the founder and CEO of CoreSchedule. I'm also a practicing emergency medicine consultant out at Wellington Hospital. And CoreSchedule is basically a system that I made that manages workforce rosters for nurses, doctors, hospitals. So basically, determining when they work, where they are, that they're doing something that they should be, making sure the right person's in the right place with the right credentials.
Got it. I'm going to guess, given your credentials and background, that this has come about not because you were looking for something to do, but more so you had a problem to solve. Am I on the right direction here?
Exactly. Yep. I basically take over the roster at every place I work, and I'm always like, I needed something better to do this with. It's too much to try and manage, with Excel sheets. And so that's how this whole thing started, is I basically created a tool to help me manage my doctors. Then it became my department, the hospital. And then when I moved to New Zealand, took it with me and was having more fun doing this than clinical medicine. And so kind of made this my full-time job and clinical medicine the part-time piece.
Love it. Look, I'm going to naively serve you up here, but, what's wrong with a spreadsheet? Because, if a doctor started or anyone started at 9 and finished at 5, which I don't know any that actually do start at 9 and finish at 5, but it's pretty simple. But it sounds like there's more to it than just saying when someone starts and someone finishes, and then you kind of just have the next one come in. Like, walk me through it for those unfamiliar.
Yeah, sure. Because it's a complicated shift work, particularly if you're looking at something like the emergency department, you have people that are rotating 24/7 throughout. And so then you have a whole bunch of regulations that apply to that. And a lot of them have to do with safety and fatigue. So for example, at one of the hospitals that we used to deal with, a group of about 13 doctors was rounding in the morning, checking on their patients. And in the middle of rounds, one of the doctors collapsed and died in the middle of the hallway. One of the other consultants ran to the nursing station, got the defibrillator, came back, shocked the doctor, and got that person back. He ended up doing okay and making a full recovery. When they investigated what was going on, they realized that this doctor was on day 14 of 18 consecutive roster days on. And when they looked at that, they're like, how can this possibly happen? And it was just a whole bunch of, there was some trades made. Nobody realized that. Come off of another service where we didn't have visibility into that roster. And it was all of these problems that just kind of lined up in that Swiss cheese model. And nobody had the full oversight of picture of what was going on for it. And so one of the things we really focus on is that fatigue and that patient safety and that doctor safety. Because if your doctor is tired, they are making bad decisions. It directly relates back to patient care. So having the tools in your tool set to where you don't have to go through and count shifts to see, like, is somebody working too much? Have they worked the last 10 shifts? That should all automatically be flagged for you. In terms of, being brought up to your attention. And so you have a lot of very busy clinicians and a lot of very busy administrators who are trying to manage rosters for hundreds of doctors. They may not know all of the rules. They definitely don't have the time to go through and sit there and manually add up, how many hours this person has weeked this pay period. So we bring a lot of those tools to the table. Most of our rosters are actually made by clinicians, which means that is patient care time that is being wasted on them doing something that could be done from an administrative wise or automated for us. So every minute we save for that clinician directly goes back into patient care.
Yeah, look, I reflect on that, and I can think of a ream of examples where if you kind of pictured it as the front, thing of a newspaper, you read it and like, well, how could that possibly happen? But then if you're in the thick of it on a day-to-day, like, yeah, well, it just this one was a last-minute change, and this happened outside of the periphery of this, and a lot of these things don't happen for nefarious or other reasons. It's just because the information's not there to give that clarity on the full picture. So that makes a load of sense. What does that look like in practice? Maybe. Because I think about too, you can't really have just a roster sitting off in isolation. And given that there's like EMRs and all the systems clinicians use, and right through to access in some places, and then through to billing as well. Like, how deeply do you have to get involved in all the other moving parts to make this really effective?
Let me give you a good example. So in a lot of our hospitals, we deal with the medical trainees. So the new doctors who have just come out, those guys rotate from department to department on average about every 12 weeks. So, this 12 weeks, they may be doing the emergency department. Next 12 weeks, they go into surgery, and then, the OB-GYN department. All of those rosters are usually very independently managed and not connected. And then where they're rotating is usually managed on some Excel sheet. CoreSchedule is one of the only companies that actually has a core allocation product that allows the hospitals to have that rotation pattern in one place where everybody can see it. And it gives the system visibility to all of those rosters so that I don't need to worry, did you work the last 7 nights when you just came from that rotation and rotated onto my service? Because I have no idea if I can't see that roster. So it's those types of things you got to be aware of. So we've done a lot of work, particularly in that trainee doctor area, to allow those allocations to be centralized so that you have access to that schedule. You can say, hey, I can see who's coming on to my service next week. And I know that they've already just been working 5 days, so I don't need to give them the next 5 days on as well.
Yeah. How does it work, given that, hospitals feel pretty much always open, or there's always healthcare to be done, right? And if we could all, flick a switch, start again and say, look, we're ready to start healthcaring in 3 months, give us time to build the new system and put this thing in place. Unfortunately, that's obviously not the case. How do you go about, like, going from an old system that's a bunch of patchwork and spreadsheets and Apple Notes and whatever else might exist onto a consolidated system so that you still can do the day-to-day?
Yeah, and that's really where we take a lot of that pain out of that system. If we basically went into a hospital and said, hey, now you've got to learn how to use this new system and get all your stuff up on it, it'll never happen. There's just, too easy. So part of our onboarding process is that we do that. Most of our staff and most of our executives have come from hospital backgrounds where they were involved in rostering and managing doctors and payroll issues. And that part of the onboarding process we completely do for the customer. So we get their rosters, we get their rule sets, we set everything up so that they don't have to figure out, okay, now how do I get my old template system, into the new pattern? So we can present the system ready to use and so that they can hit the ground running. Otherwise, there's just too much going on for people to kind of carve out that amount of time that, now we got to convert to a different system. Just won't happen.
Yeah, exactly. It's one thing for everything to be neat and tidy on one system, and I get the need to be able to manage fatigue of clinicians, and there's other challenges no doubt too that are addressed. How would a hospital system or a healthcare provider measure whether it was successful or not? Like, how do you measure the impact or success of implementing a CoreSchedule solution?
Yeah. So 2 of our biggest indicators are, 1, the reduction in the amount of time that it takes to make and manage a roster. A lot of our customers have seen up to a full FTE of savings of what they were just be doing managing the rosters. And you can save an actual entire 40 hours a week by going over to CoreSchedule. The other thing is things like reduction in sick time. So if you have a roster that allows you to easily trade and swap shifts and move things around, you're much more likely to take some responsibility for that roster and see if you can have somebody cover you if you're not really feeling well. If you don't have those options and you can't even see the roster because it's on Excel in the hospital, then you're more likely to just call out sick, and take that pathway. So we've seen up to like a 12% reduction in sick leave from our trainee doctors once they get access to all of the tools in CoreSchedule to try and help them move their stuff around and cover their own shifts.
Super cool. And lastly, Stephen, what are you working on? What's on the roadmap or the vision or what's next for CoreSchedule?
Yeah, so AI has been a big piece of what we've been working on. So we've been rolling out AI features incrementally, almost seems like every few weeks for it. So, being able to say, hey, I want to be able to equitably distribute where I'm working, my call scheduled, who's working where. Making AI modules for that, AI generation of schedules from scratch, as well as what we're working on. I'll be rolling out all of these features soon from our customers. Lots of exciting pilots going on, and seems like the technology is changing weekly almost.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.